Hi there, you're welcome to Demi RX Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit that like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and content here on our YouTube channel. Also, as a gift to you for subscribing to our channel, you can check out the link down below, which would get you to the free meal recipe that we have here on Demi RX Care. All right, thank you for watching and stay blessed. RX Care. So let's jump right into our medication of choice today. So our medication of choice today is known as Humira. Humira is also known as a generic name that's called Adalimumab. So what is this medication for and how do we use it? So this medication, Humira, can be used for tons of conditions, especially in our patient population. So one of those conditions include Ankylosing spondylitis, which is basically like a fusion of the spine area, the fusion of the bones in the spine area. And usually in this patient, we will take about 40 milligrams as a subcutaneous injection every other week. Also, this medication can be used in patients who have Behçet syndrome. This patients usually take about 40 milligrams subcutaneously every 14 days. Also, this medication can be used in Crohn's disease. It can be used in plaque psoriasis. It can also be used in psoriatic arthritis, as well as rheumatoid arthritis and ulcerative colitis. Usually, for the most part, patients would take like a 40 milligrams subcutaneously every other week or every 14 days, or patients will usually start at a higher dose and kind of taper down to that 40 milligram dose. All right, so how does this drug come? So this drug comes in a pen, and it also comes in a subcutaneous solution that you will have to draw out with your needle and your syringe. So what are some side effects that are about this medication? All right, so side effect of this medication includes headache. This medication can also cause runny nose. It can cause back pain. It can cause rash, abdominal pain. It can also cause like an injection site pain or redness. Usually we see that more often in patients who are taking any medication that requires a needle or pricking your skin area. You're more prone to have like an injection site reaction, maybe like a redness, an itching, or pain in that area. Also, another common side effect of this medication is upset stomach, as well as increased risk for infection. Alrighty, so what are some of the serious side effects that you want to know about Humira, especially on how to be able to use it safely and effectively? So some serious side effect that you want to definitely call your doctor's attention to is skin lump, any form of breast tenderness, or any form of night sweats, drastic loss in weight, any form of abnormal fever, a burning or tingling or feeling, any numbness or pain or pressure in the site where the injection is given, as well as any shortness of breath, any pale skin you start noticing after using the injection, or if you have any bad skin reaction or irritation, then you definitely want to bring this up to your doctor. Also, if you start noticing any swollen glands in certain areas of your body, such as your neck, underarm, or your groin area, then you definitely want to call your doctor's attention to that. All right, so let's talk about how to be able to use this medication and what to look out for while taking this medication. So Humira is usually given as a shot, and it's usually a shot that is placed in the fatty part of your skin. So your doctor may teach you how to give the injection, or they might advise that you come into their clinic in order for you to get your injection whenever you need it. This medication may also be given with other medications such as allergy medications like Benadryl, cetirizine, or loratadine. These are medication that will reduce any allergic reaction that might occur with the injection. Also, this medication can also be given with a fever medicine such as Tylenol in order to kind of reduce that allergic reaction effect that may occur, as well as a steroid medicine. And these all together are used to kind of reduce any infusion or any injection related reaction that may occur while you're on Humira. Also, if you are going to be injecting this solution at home, make sure you do not shake the solution. Do not use the solution if it's cloudy, if it's leaking, or if it has particles in the solution. Also, if you notice that the solution has changed color, you also want to make sure that you avoid using this solution in order to avoid any form of expired medication that may be given. Also, you don't want to place this subcutaneous injection into an irritated or red skin area. Before you use this medication, you want to make sure that you wash your hands before and after injecting yourself with this medication. Also, in terms of injecting yourself, you want to make sure that you're moving the site of the injection. That way you can reduce the chances of having any injection related reaction in that particular area of your body. Also, after injecting yourself, you want to make sure that you throw the syringe away into a sharps container or a sharp disposal. When the box is full, then you want to make sure that you're following any local rules in terms of discarding your injection or your syringes properly. Also, you can talk with a pharmacist if you have any questions regarding how to dispose this off properly. Also, another thing you want to know is if you do not end up using the whole injection, you can go ahead and make sure that you're discarding that properly. And if your symptoms or health problems become worse while you're on this medication, you want to make sure that you're bringing that up to your provider. That way they can evaluate and make sure that this medication is actually being helpful for the condition that you're taking it for. You don't want to share this medication with anybody, so you want to make sure that you're also not taking anyone else's drugs while you're on this medication as well. In addition to that, you don't want to administer 2 doses at the same time or any extra doses if you felt like you didn't inject the whole medication in your body. You want to make sure that you're seeking medical advice before injecting another dose if you have already injected one previously. Also, it is advised to avoid live vaccine while you're on this medication. So an example of live vaccine will be like the cholera vaccine. It will be the nasal influenza shot, as well as your MMR, also rubella. Those are vaccines that you want to avoid while taking this medication, as that might increase the side effect of those vaccines. Also, this medication may increase risk for certain cancers such as lymphoma or leukemia, so you want to make sure you're checking with your doctor if you start noticing any abnormal side effect. Also, when patients are taking this medication, they usually have to take a hepatitis B test as well as a TB test in order to make sure that these 2 conditions are ruled out in those patients in order to avoid any increased risk in mortality for these patients. All right, I hope I was able to help in terms of what to look out for and how to take this medication properly. If you have any further questions, you can check out our website at www.demyrxcare.com, and there you'll be able to consult with a pharmacist who will take you through how to use this medication properly or answer any immediate questions that you do have. Thank you for checking out our channel, and don't forget to hit that like and subscribe button. Thank you. Bye-bye.